Hello, my name is Jenna Mansell. This is a presentation for Nursing 405 Leadership Capstone. It's about improving compliance with discharge process. It's for summer 2024, and my leadership mentor was Terry Bailey. Thank you. After reviewing the quality dashboard at my facility, it was noted the discharge process has broken down. There was 50% or less on the following things: the follow-up, appointments being made prior to discharge, the discharge notices being signed for swing patients, patient choice letters being completed for home health services, hospice care, DME choices, and skilled nursing facilities, and Medicare important message being given out and signed prior to discharge. This is a liability to the hospital and a stop in the continuity of care. We must increase all of these to stay Medicare compliant and continue to get funding for our facility. 200.3.4.2 follow-up copy of the IM or CMS Guideline 10065. That's the titles of the Medicare Important Message Delivery. I put on here for word what it says in the Medicare guidelines and when it should be delivered. But it says that hospitals are required to provide the important message from Medicare to all Medicare beneficiaries who are hospitalized as inpatients. That is both Medicare Advantage plans, which could vary from various insurance companies now, and traditional Medicare. This message informs patients and beneficiaries about their rights to appeal and their hospital discharge. It is very important. There is one given on admission, which our registration department does an amazing job of making sure that is signed when they come into the hospital. But it says that one has to be given, again, 48 hours before discharge. No more than 48 hours before discharge. So it is our duty to make sure that we are getting these completed. Medicare discharge requirements. Nursing staff must give a patient their list of their medications and be educated on any new medication that was given while they were inpatient. They must also be educated on any new medical diagnosis or medical procedure that was done while they're inpatient. Staff must also help arrange all referrals for other care, including referrals to physicians, home health, skilled nursing facilities, hospice, and DME suppliers. This is the patient choice letter that I talked about earlier that must be completed if you need any of those referrals. It's super important to continue with that and to make sure that the patient knows that they have multiple options depending on their insurance providers. And then secondly, the staff needs to educate the patient on how important it is to complete that follow-up care. Their studies show that if a patient shows up and gets seen for their follow-up care, they drop up to 50% of patients that are readmitted. So that's very, very important, and we need to really push to these patients that they need to go to be seen to help reduce our readmission rates. AIM. The improvement plan discussed by my leadership mentor and I involves enhancing the discharge process. Currently, there's inconsistencies in how the process is being carried out, with each nurse approaching differently and documenting their actions in various ways. We have CPSI, and there's so many different ways to do things in that system. And some nurses use CPSI at different facilities and then come here, and the way we do things are different. So I think it's necessary to establish a standardized procedure for discharging patients so that all nurses can follow it. Our primary focus is to improve the accuracy of discharge paperwork for every patient, but everything should be done the same way every time by every nurse for quality reasons, and I think that's why we need to rehaul the discharge process. There needs to be continuous documentation on the education that is provided to the patient. I know that there's like check boxes saying that you did it, but what did you educate on? If we could get just a little more specific on the education that is being provided to each patient. But our goal is by October 2024, Allen Parish Hospital aims to enhance the discharge process for our inpatient unit. Our goal is to ensure that 100% of patients have all the necessary paperwork completed before they are discharged. Additionally, we will audit 100% of the charts to verify the presence of this paperwork. Plan to collect data. After thorough education and training sessions with the nursing staff, the team should be equipped with the knowledge and skills to effectively execute the new discharge process. The case management and quality team will meticulously conduct a discharge audit on 100% of the patient audits over the next 3 months. The audit involves a detailed examination of various quality indicators, including the adherence to the new process, patient outcomes, and overall effectiveness of these interventions. The data collected will be analyzed to provide comprehensive understandings of the impacts of the new process on patient care and patient outcomes. The first step in the intervention is to go through the SOP and clean it up. Make sure there are not any extra steps that need to be removed. But the most important part is to add the steps of the paperwork that was being missed on the quality dashboard, like the patient choice letter, swing discharge, and Medicare important message delivery. And then we can start with the education. There needs to be education on the Medicare requirements. I'm not sure that the nurses know the requirements, but it's good to educate them on that and to get the why of why we're doing something. It's important to note that the patient demographics would stand to benefit from compliance with Medicare standards extends to all individuals who utilize the hospital or clinic, including seniors, low-income individuals, people with disabilities. The potential loss of Medicare funding due to noncompliance is a critical concern, as it would lead to significant impact on the availability and quality of health care services for our entire community. This could be particularly devastating given that facility is the only community hospital within a 30-mile radius, making access to health care services a major concern for residents in the area. The financial impacts of this intervention would be low, as we have minimal staff. We could do the training during a nursing staff meeting so that there wouldn't be you wouldn't be paying them to come in just for this training. They're already there for that meeting. This training could be done in 15 to 20 minutes. And since we do 2 staff meetings to cover all staff, it shouldn't be an issue. We should incorporate I made this simple flow chart to make sure that all the paperwork and discharge appointment is completed prior to discharge. It's very easy to follow. Let's just go through it real quick. You can get it done real fast on discharge. Does this patient have Medicare? No, you can move on to the next step. Yes, just get that Medicare important message signed and get into that patient. The second question, does this patient have an order for home health, nursing home admission, hospice, or DME? No, you can move on to the next step. If it's a yes, a patient choice letter needs to be completed. And then the third question, was this a swing patient? We try to rehab as much of the community close to home as we can, and this means that we have a lot of swing patients. But was it a swing patient? Yes, get the swing discharge form completed. If not, you can move on to try to schedule that discharge appointment. We'd like to get that discharge appointment scheduled before they leave the facility. Studies really shown that it increases compliance with the discharge appointments, and the discharge appointments being done increases by 50% if you get them done, if you get seen within 7 days. And once you get to that last step, you are cleared to be discharged with the paperwork anyways. So this is just a chart that I made to show the discharge requirements and the growth that we've had so far. So we started monitoring this for this project in June of 24. We were at 50% for MIM letter of choice and swing discharge letters, and at 40% for DC appointments completed prior to discharge. In June, you see we've had major growth just by introducing that flow chart that we've seen on the last slide. We're at 80% for MIM, letter of choice, and swing DC, and 70% for DC appointments. I think that that's going to lack because if discharge occur on the weekends, then it's not done prior to discharge. But I think with education and training that we could get this at to 100% in the next 3 months. This is just a reference slide. It has all the information that I used for this presentation, mostly the Medicare guidelines. Thank you for watching and paying attention to my presentation. Bye.